All right, thank you for staying with the Monday Report. We see a lot of your feedback coming through on hashtag Monday Report at Trevor Mbija at Citizen TV Kenya. We'll sample some of them during this broadcast. The conversation we're having is, should the schools be reopened or not? And if yes, how? If not, why not? The National COVID-19 Education Response Committee is taking views from the public. It ends on Wednesday. Joining us now live is Honorable Wilson Sossion, NAT Secretary General, is joining us live from Bomet. And Amos Kaburu is a Program Manager, PAL Network, and also an education expert. Thank you so much for making time for us. And Janet Mudhoni Ouko could not make it. We'll try and reach her during this broadcast. If she is available, she'll join in. Honorable Sossion, I'll start with you. Is this the right time to open schools? You've been quoted as saying that an entire year should be skipped. What exactly does that entail from where you stand?
Yeah, fundamentally, we are dealing with a disease, and we must respect the expert advice. The projection from the medical personnel and professionals is that if schools are reopened, when the virus has not been contained, schools will act as spreading zones, and we'll have a research back into the communities, considering that over 80% of our school children are day scholars. And the actual projection is that if the current trend is anything to go by, if schools resume in June, then by the month of August, we'll have a peak of the spike with a projected 30,000 deaths. I don't think as a country we'll be prepared to see our children get infected. We close down schools again, and we begin witnessing more death. We have seen globally, this trend is very difficult. South Africa tried to reopen schools, but they've had to postpone because they've not reached any proper agreement with the teachers. We've seen today France, 70 schools closing down again when a number of students were infected by the virus. So I don't think this is a matter that we can engage on so carelessly, educationally speaking. It is a health issue, and we must invite the expert advice based on the prevailing situations and the trend. We have seen yesterday 57 new cases, and so at this time, it will be fundamentally wrong for anybody to project and propose a date of reopening of schools. But we will not wish.
But Honorable Sossion, the WHO itself says that this virus may be here to stay. What do you suggest we do going forward? Well,
the virus may be here longer with us. But of course, we cannot invite the virus to kill all of us. There are already guidelines. Particularly, what is in place at the moment is that people stay at home, ensure that there is social distancing, we sanitize. Those are the measures to prevent the spread. And reopening schools mean it is not going to be possible to enforce those regulations. We have seen, even from the UK, quite a number of schools, that it is not possible to enforce social distancing in terms of children, and some are grumbling about reducing the class sizes. It will have to reduce substantially, and many of these measures are not working. Therefore, it is too early for us to talk of reopening schools without sitting to strategically to develop proper measures. And let me tell you, Trevor, the checklist that has been given by UNICEF, the number one item that must be considered is the safety of teachers and learners. And the UNICEF and World Health Organization has made it very clear that unions must negotiate with governments so that we get proper conditions and agree on what would be the proper time to reopen schools. And so we cannot casually at this stage begin pronouncing that, oh, we can open schools in the month of June. Nobody is very sure because we don't know the trend of the virus for the next 3 weeks.
Okay. Amos, should we be opening schools now? Kaburu?
Thank you, Trevor, and good evening to our viewers. The fact of the matter is that schools will open, whether they'll open next year, whether they'll open next week, but at one point in time, schools will open. What we know is that we have a responsible government, whether by choice or by design, because the people of Kenya, in their wisdom, elected a government. And the same people of Kenya, through their representatives called Parliament, enacted the Basic Education Act in 2013 that provides for the responsibility of planning, designing, and implementing education is vested on the Ministry of Education, of course, in consultation with the different stakeholders. And so the highest oath of office that any responsible government does is to protect the lives of its own citizens. So it's important to take a little bit of history of how the ministry has handled this issue. And one must appreciate that government was quite strategic, and I think it made, in my opinion, it made a wise decision to close schools at that point in time because we had limited information, and up to right now we still have limited information on the nature of how the virus is spreading and the likely impact. Nobody can really tell. And I agree that this is a health problem. It is not just an education problem. It is because education attracts a lot of interest because virtually everyone is affected by education.
Yeah.
You could be having your children in school. You could be having your nephews.
Yeah.
Education means a lot to everyone. So it's important that this conversation elicits a lot of interest.
Yeah.
But government has been responsible enough, one, especially the Minister of Education, keeping Kenyans up to date and demonstrating that it's interested in making the decision that at the end of the day will really be of less negative impact. I do not think that government officials seated somewhere will be quite irresponsible to imagine that they would want our children to die, because they also have their own children in schools. So I think at this point in time is rather putting the cart before the horse in concluding that perhaps the government wants to kill our children. I do not think that any responsible government would do that. So I think the move and the measures taken by the ministry must be welcome.
Yeah.
And what we all of us need to do is to thoroughly engage with the process.
Yeah.
And really see that where there's expert opinion, where it is required, it is also taken into consideration.
Yeah.
Where there are international protocols, they are also observed, but also in terms of also looking at the context in our country.
Okay.
Because you cannot expect that everything perhaps that works globally in certain contexts will also be working in our own context. So the aspect of contextualization, looking at what will be possible for us to ensure that learning is continuing,
yeah,
I think there will be very, very important steps to take.
But Amos, we've only tested.
I am convinced.
Amos, we've only tested about 40,000 since the first case of coronavirus came in. Do you think right now we have the ability to test all the learners, all the teachers, all the non-teaching staff, and then keep doing that after every 14 days in all the schools across the country?
I think, as I say, that is putting the cart before the horse, because I do not think that the ministry has said that that's what it's going to do. And that's why I'm like, it's good to allow the process to go on. Look at what this committee, because it's drawing membership from broad stakeholders, looking at the statement that came from the Minister of Education when it was setting up this committee. And considering that it is welcoming public views, and it's also, I am sure, trying also to perhaps maybe include expert opinion, and understanding that government has the ability to land on a lot of information, which is real time, that all these things will really be considered when a decision being made. But I do not think that where I sit as in my limited space in terms of looking at education and how children are learning, I can be in a position to comment on whether government has the capacity to test children in every village or in every hamlet. There could also be a strategy with which government is taking, because I do not speak for government, but definitely you have also to undertake these measures when you are looking at your resource basket. You cannot employ a technique that perhaps cannot work. And that's why I'm like, it's good that we are very cautious, even when we look at international protocols in terms of how we are handling the pandemic. we look at how it is contextualized.
Okay.
But right now, just concluding that government has the capacity to test all children or not, I do not think that I have the bandwidth to firmly comment on that.
All right. And Honorable Sossion, you have mentioned before that we should repeat an entire academic year. What would that entail from where you sit?
Globally.
Yes.
And economies that have tried to resume learning, quite a number of them are suspending reopening of schools. I don't think it will be a wise idea to compel resumption of learning when it is not appropriate, merely because of exams and merely because we think we must promote students to the next level. As has been stated, nobody's sure when exactly schools will reopen. We must prepare psychologically to stay with our children longer if that will be necessary, even if it means resuming, skipping a whole year or a whole academic year so that we can resume at a certain point when the virus shall have been contained. It is better to lose a whole academic year than to lose lives. And I think the priority here, and this is a checklist as we contextualize international protocols, the safety of teachers and learners. And what is on the table is that we must negotiate. Unions must negotiate. What is happening at the ministry is not negotiation. The task force that has been established is not representative of stakeholders. We don't have unions sitting on in that task force, whereas it's very clear globally through UNICEF and who that unions must negotiate. And we have seen in the UK, all unions in the education sector negotiating through the Labour Centre for the resumption and the conditions. And in South Africa, we've seen the minister having it very rough, trying to convince the union, but the checklist has really been complied with. That is not happening in Kenya. The process that is in place is not sufficient, and it will not guide this country properly. And therefore, we must think properly and bring all the stakeholders on board. We've not brought in the Council of Governors because we'll be talking about the healthcare support from the county government. And you know, healthcare system is devolved. Yeah. And this category, they must be brought on board. The civil societies, they must be brought on board. The university staff unions, they must be brought on board. The membership of the task force does not require any salary or any payment. We will be willing to sit in that committee for free. And so, therefore, we cannot engage in treacherous and dangerous actions in the name of compelling resumption of learning. And who tells you that all governments have been responsible all over the world? No, South African government is a government. It tried to pause reopening of schools, but it's very clear they've not met the necessary minimum requirement as per the checklist. In France, we have seen closure of 70 schools. Yeah. I'm sure it must have resumed through guidance of government. Yeah. So we cannot sit as citizens and say the government is an angel. No, the government is all of us. We are citizens. We must participate. We are dealing with a disease, and we must invite the expert advice. And we must, the process of reopening of schools must be free, and it will reach a point, particularly when it comes to workers and personnel. We shall eventually sit and negotiate with the Ministry of Education on the terms of resumption. Okay. And the ministry must convince us that it has met the necessary minimum requirement. Okay. Because the lives of children and the lives of teachers are paramount. We are not going to be herded back into work like slaves.
Okay, let's bring in Kaburu on this. And Kaburu, what do we do then in the meantime? Because there's a report that came out by Usawa Gender Report. It shows that only 22% of children in Kenya can access online learning. That means a whooping 78% cannot access it. Only 10 out of 100 parents know that their students were supposed to be even learning right now as we speak. Most of them just believe when the schools were closed, that was it. So what do we do then in the meantime?
Thank you so much, Trevor. And those are many dilemmas that we have. The truth of the matter is that maybe very few of us, me excluded, were there in 1918 during the Spanish flu. So we therefore do not have the experience of the expertise in terms of incubants that will explain how to deal with a pandemic. So they are definitely, the entire world is grappling with how to deal with it. Even developed economies such as the US are the hardest hit. Economies such as Italy are the hardest hit. And therefore, nobody can claim that they have the monopoly of expertise in terms of handling pandemics. But rather, it is the question of really looking at what is working. And if there is any point we've argued that people must listen to their governments, then this has been one of the time. Because any slight deviation from the very, very basic things that government will be giving you, such as wash your hands, put on masks, observe social distancing, stay at home and such, if such are not respected, then you can end up to have a situation such as what we've seen in the US and in other places. The reason why we bet for governments, it's because governments have the ability to marshal the entire infrastructure, both within the entire government architecture framework, which includes the human resource and the resource configuration, and also the information capability that government has. And equally the general public, the public goodwill that government is capable of marshalling at such a point in time. So one must appreciate that whatever efforts are taking place right now as far as learning is concerned, they cannot be optimal, because the way we have designed our education, it is still an education that is defined by a classroom. It is still an education that is defined by the presence of a teacher and the learners in that particular context. But looking at the nature of how we've transited because of this pandemic, one cannot argue that you will definitely be expecting to see learning being optimal. So I also belong to people who generate data a lot, but I think at this point in time it's important for us to have that disclaimer that it will be expecting too much that optimal learning will be happening at this point in time. Because even if we say that technology will be the panacea to this problem, we also need to acknowledge that there is also the mental readiness of these children, because learning also takes place within a certain context, and children must have a certain level of readiness mentally together with their teachers for this particular learning to be taking place. But if you look at what is happening around, there is a lot of anxiety. People's lives have been disrupted to a large extent. People have lost income. People don't know what will be happening tomorrow. There is a lot of fear. So you cannot even expect, even young children, they become equally frustrated. They are wondering, when will our schools be opening? You look at children trying to talk to their friends over the phone, and you look at the level of how they have missed one another. Try to picture what these children are going through and put on some little empathy for them. Our children knew that they can go out to play with their friends. They knew that was their life.
Yeah.
But now our children have to stay indoors. Okay. You can imagine what heroes we are making of these children. Actually, they are the greatest heroes and heroines of our time. Okay. So we have to understand that we are living under certain tough conditions, and to understand that fighting COVID is equivalent to being in a war zone.
Okay.
So we cannot expect that learning will be happening normally, whereas we are in a war situation.
Okay.
This is what we call education in emergency. This is what we call crisis moments. So we cannot expect that everything will be happening with a certain level of normalcy.
Yeah.
So I would request that we look at all this kind of evidence within such a context.
Okay.
But otherwise, imagining that things will be the same, of course, one will perhaps have thought that maybe if we had resource configuration in a different way, maybe if ICT had been penetrated to a certain extent, these things would happen a bit differently. Yeah. But even look at it, Trevor, and SG is on this conversation can tell you that even when children are with their teachers, we have a large proportion of them who are struggling to learn.
Okay.
So it is not that when children are meeting their teachers and they are having one-on-one interaction, that the learning that happens is optimal. So we, as many people have written, technology is not the panacea to learning. Okay. Technology is just a platform like any other one. even if you decided to have a panelist and who don't have content, even if you loaded this conversation on Skype or you brought them on TV, it will still yield the same results.
Okay.
So we also have to underscore that yes, technology has a role it can play, but it is not panacea to all these problems. So that it's important therefore to have some level of putting a disclaimer and some kind of discounting of the evidence that we are collecting, especially at such a point in time.
All right, let's bring in Honorable Sossion on this, and then
that when decisions are being made at this point in time, it's important that we are very sensitive, because when you make decisions during crisis, sometimes you can end up to have an error of judgment. So that's why it's important, why we welcome the Ministry of Education humbly accepting that they are not the monopoly of all the information, and therefore putting together stakeholders and opening up spaces so that even ordinary citizens can share their views, including even the poll that you are sharing right now. So that you share it with the Ministry of Education, so that when they are making a decision, it is a responsible decision.
Okay. Honorable Sossion, all factors held constant, and you said that there needs to be some minimum measures that have been put in place before we even talk about opening of schools. What would you like to see? All factors held constant. The virus is still with us. The numbers are still soaring. What minimum measures would you like to be in place before you can even consider schools being reopened?
It really is not my minimum measures. It is the minimum measures provided by the World Health Organization. There's a checklist, and number one on the list is a total guarantee of safety of learners and teachers, and of course all other personnel in the learning institution. There must be that guarantee. Therefore, that means, one, the virus should have been contained substantially within the country and within the context of the healthcare management system. That's the truth, because for learners to go back to school, you must convince their parents that they will be safe. In fact, if you do a study at the moment and you check with many parents will not be willing to release their children to go to school as long as there are still reported cases of the spread of the deadly virus. Many parents will not release their children as long as we still see the death cases rising. That's the truth. So number one thing in the checklist is guarantee of safety of learners and students. Number two, there are, of course, several other measures with respect to workers. There must be provision of personal protective equipment to teachers and workers and in the learning institution. This one will need to sit and define and negotiate with the government. So this means mobilization of resources. There are a number of things also to guarantee the safety of learners, which many governments have tried, like phasing out reopening so that they can reconfigure the sitting arrangement in the classrooms and reducing the class sizes substantially. That, if you look at it in the context of Kenya, where the same ministry that is being glorified without planning came up with 100% transition, classrooms are congested with students as many as 70, dormitories are congested. If we are to resume in the month of June, we've got to reconfigure completely to reduce the class sizes and also to reorganize the number of students by dormitory. This is a lot of work that needs to be done. As we contextualize the checklist to the Kenyan situation, we must address ourselves to the very realities that exist within learning institutions so that we can continue enforcing social distancing and the necessary health regulations. Are we really ready as a country to do this? And very finally, and we have seen from your news bite that stress is affecting teachers and affecting everyone else. Do we have the necessary psychosocial support to offer to learners and teachers? The checklist is long, and currently we are working with a team of professionals, including medical experts, so that we can generate what is right, away from the current process that we don't see it. In fact, when we talk of a stakeholders process, that excludes teachers, and teachers will be the frontline workers at the school setting. What are we talking about? So it is wrong for some of us, and I have great respect for Amos Kaburu, to begin praising the ministry and government and deceiving that Kenyan that everything is wrong. From the other perspective, the task force that is in place will not deliver as long as teachers are excluded, and particularly unions are excluded from sitting in that task force. And other critical stakeholders, we need at least a health expert to sit in that committee. It is about generating policy direction, and you cannot generate policy direction with exclusion of key stakeholders. And we've mentioned so many. This is a unique situation that we need to work with open hearts, open minds, and work with all the stakeholders. It's not a simple issue. It is war. It's one of the biggest war ever experienced by government, and we need to mobilize everyone and everybody. And I conclude by stating very clearly that the medical experts, if we talk about the Spanish flu of 1918, you go and ask the doctors. They've got the history of diseases and history of occurrence of pandemic, and even the mechanisms of spread, the control. They will tell you that probably Kenya might attain the peak of this infection in February 2021. But if we open schools, we'll attain the peak by August this year with so many deaths, numbering over 30,000. You can't run away from this fact. These are projections. Let us not behave like some countries that want to pose reopening of schools, reopening of markets, and doing it is dangerous. And I like what the president has stated. The president has stated very clearly that we cannot engage in an action that will lead to a spike. And I think that is the footnote from the president's message that all of us must be thinking toward that direction.
All right. Honorable Sossion and Wilson and Amos Kaburu, stay with me for a bit. We're taking a quick break here on the Monday Report. When we come back, we'll sample some of your views that came through on video, and also a lot of feedback coming online. We'll also sample some of that in just a bit. See you shortly.